Some of the, I'm trying to bust the myth of venous disease because I've noticed over the past 12 years, 13 years, a lot of patients are asking me things which are absolute myths. So I try to go through some of them very quickly for the audience. Number one question is if they're treated, are they going to come back? And no, if they're treated properly, they shouldn't. But you always need to have some maintenance. You always, just like going to a dentist. Insurance companies don't pay for these. That is not true. If you have symptoms, insurance pay for it. If it's cosmetic, then they don't pay for it. If I have my veins treated, they're going to come back with vengeance. That is not true. I try to compare this to clipping your rose bush. If you just clipped one or two leaves or branches, you're going to get 3 or 4 in its place. Spiders are the same. Spider veins or varicose veins, if you do not treat the underlying disease, you really literally need to go to the root of the rose bush and destroy it. You just don't go and clip it. You just make it angry. So that is probably one of the reasons why they have a tendency to come back with vengeance. One of my patients asked me recently if I exercise, can his varicose veins go away? And I like him to exercise, but no, varicose veins are not going to go away. He might slow down the disease, but they will not go away. This operation is painful afterwards. It is not. The risk of clots are very high. They're not. It is an operation which is done in the hospital. It is not. It's actually done in the office under local anesthesia. There is stitching. There's no stitching. I don't stitch anybody. There's a scarring after you have this procedure. There's no scarring. They're just tiny puncture wounds which disappear. Recently, I had a patient that his vein stripped, and he had almost an inch incision. That you compare that to 0.1 millimeter, it is a whole difference. So the bottom line is no, there are no scarring after this procedure. If I bleed from my varicose veins and they stop bleeding, that I will not have any more problems. No, the chances are if you bled, you're going to bleed again. I strongly recommend you see a phlebologist. I went to the emergency room. One of the questions is, I went to the emergency room, my vein was bleeding, the doctor stitched it, and am I cured now? Well, that's like trying to stop a water balloon from leaking by stitching the water balloon. Every hole that you left there in the stitch is going to leak again. So I suggest see your phlebologist as soon as you can. If I have my varicose veins treated, I may get clots, but if you don't have your varicose veins treated, you probably will get clots. And I think the risk is higher if you don't have it treated as opposed to having developing a deep vein thrombosis going through the procedure. There's a little controversy here. If you're going to have a procedure on your leg, like having a total knee or whatever orthopedic procedure you're having done, and you have these gigantic varicose veins, a lot of my orthopedic friends refer the patients to me to have their veins treated first before they have the procedure. I think it's advisable. So a lot of my patients feel that they need to have their knee taken care of first before they have the varicose veins. I think if you have giant varicose veins or you have severe venous insufficiency, it's going to affect the healing of your leg after the procedure. So it's advisable to have your veins taken care of first before you go and have your orthopedic procedure done. I believe it was the year 2000 when FDA cleared the laser treatment of long saphenous vein, and within a year, I believe it was a short saphenous vein, they approved. The minute the FDA cleared it, I started the inception of the Vein and Laser Center of Wilmington. Since then, I've done close to 6,000 or 7,000 laser ablation alone, and we've done a lot of other vein work in the meantime. I feel a lot more knowledgeable now and skillful now than I did 10 years ago and 12 years ago, and I believe 6 months from now I'm going to be more knowledgeable and skillful than I am now. With surgery, I believe It is like flying an aeroplane. How many hours do you have under your belt? And I believe the longer you do these procedures, the better you get at it. And you continue to improve. My philosophy in Scarless vein care, and probably my philosophy as a physician, as a surgeon, is always try to do the best you can for your patients. I'm not saying anybody else is not trying to do that, but I believe that at least in my practice, I do my very best to be the best. Since I was a child, my parents always taught me to be the best I can be and be the best to my patients, to my friends, to anybody that I could be. In order to stay the best, you can just talk about being the best, but what are you doing? How are you showing it? And by having the latest and the best equipment and the best technology, I think that's the only time you can say that you're the best. I buy the very best ultrasound machines that I can afford, and they continuously upgrade the technology as soon as they come with an upgrade. With the laser is the same thing. I make sure we get the best laser which comes out. There is a new laser again coming out in a few months in August. We did the trial for the company. I'm very lucky. We were one of the 4 centers in the nation and the other 3 were academic centers, I believe. And I'm the only one in private practice who was actually asked to participate in this trial. And here we are in Wilmington, North Carolina. The other places were Chicago and Tampa and I think New York. I think I've been very lucky. I think I really thank God to have helped me to achieve some of the things I've achieved, because it's been more than luck. To have the crew, the staff that I have I honestly think it is just more than luck, because I have some of the best people working for me. I have excellent ultrasound techs. It takes a lot to, you cannot do the procedure if you don't have good ultrasound techs. And if they make a mistake, then we all will suffer. So it's important to have dedicated and smart and skillful ultrasound techs. And having said that, literally last few weeks ago, we one of the ultrasound companies came to me and said that we've just been selected as one of the centers of excellence, and I believe we are the only practice in private practice who have been considered as a center of excellence, and the other groups have been big university centers. I make a point of having at least 2 meetings a week with my entire staff, not just part of the staff, the entire staff, and usually more than that, more meetings than that. And what we're discussing, we're having everybody's input. What can we do to do things better? How can we incorporate new technology? How can we make our patients happier? How can we make the patients wait less? How can we offer the best prices to our patients? And I believe right now we're pretty competitive in our pricing. To be good and to be a center of excellence requires a lot of dedication. I don't get paid more or less to get a new laser to use on my patients, a new technology, but I believe it is my job, morally and ethically, to make sure my patients are getting the best. You only stop when you have achieved your goal, and the goal is what the patient came to you in the first place and told you what the problem was.